Okay, I think we are live. Um, Today is February 13th. Hope everybody is doing well. Um, let's see, what are we doing? I just finished working on some new lectures for CTisus. I did one on the anterior mediastinum. It's a four-parter. I think that's going to show up in May 2025. So working on updating old lectures, but working really hard on creating new lectures. And I've never done one on the anterior mediastinum specifically. So we've put a lot of effort into really redoing it or starting it from scratch basically. And I think it came out really well. It's four roughly 20 to 22-minute talks. So hopefully May will be a good month for that. This month, of course, is cardiac month. It's February, cardiac February. Tomorrow is Valentine's Day, and I guess that's how the link up started. We do have, as you know, apps on cardiac. You can go to the Apple Store. There's a Coronary CTA app. Our cinematic chest app also has a lot of stuff related to the heart and vasculature, so that's there as well. There's a bunch of lectures we have on cardiac and vascular, and I'm working on some new lectures. There's a lot of, in the CTisus website, teaching file material, a lot of really good content for doing cardiac CT. Now, when I do my new lectures, I'm trying to think about how to do them, but I may divide them up into different parts in the sense that coronary CT calcium scoring, we've been doing it for decades, right? But now it's really popular. Now every internist is getting it for their patients over age 45 roughly. It's a quick study, low dose. Again, a very good risk predictor. The obvious best score is 0. Not that many scores where you get 0 is it the best. And then we know risk stratification based on what the score is, your age and gender. And again, putting that all together, it's an easy study, but better than anything else. And in patients, whether they're going to get certain meds, the calcium scoring is really a very good way of making that prediction. Now, we don't follow calcium scores because calcium scores will rise, and on some of the medications, they actually even rise more, but it's that relative score and how to manage the patient. Obviously, you want a 0 score, but even on the high scores, calcifications in the wall, and we worry about vessel patency. So, but again, with all the statin therapy, it does really good job in helping manage patients. Calcium scoring is good to do. Surely if you have a family history of cardiac disease, if you have elevated lipids or abnormal lipids in your blood, but just in general, everybody should get one at some point and go from there. So it's pretty easy. The next thing, of course, we talk about is coronary CTA. A lot of work being done with different companies doing all sorts of AI for looking at vessels, not just looking whether there's stenosis, but the extent and grading, and using AI to help predict the importance of plaque, the danger of a specific stenosis, whether patients should be monitored or patients should have more of an intervention are being done. There's a few different companies that are doing that. So a lot of work is going on. As scanners get better, the quality of the studies are better. Also, for the most part now, people recognize that giving metoprolol, anything to reduce the heart rate, works well because, again, patients with that 60 heart rate jump up to 70 the second you give the IV contrast. Okay, so it's things like that that become very, very important. We also know with the coronary CTA the importance of post-processing, being able to look at distribution of the plaque. The density of the plaque, fat, or calcification becomes very important. Quantifying that becomes important, and there's lots of new programs that go into that. And I will speak about that when I do my talks. Hopefully that'll be over the next month or so, which means you'll see a lot of the information probably in the June to July timeframe. So that's very important. We still, I don't know what you do, We do coronary CTA 7 days a week, 7:30 to 7 o'clock, or 7 to 7. We don't do it overnight. I think that's the way most people were and still are. Calcium score you can get 24/7, but you have to wait on the coronary CTAs. It's just a matter of being able to put things together. Uh, People have said, well, why don't you just scan the patient and then read it in the morning? There's some logic to that, except then you're concerned, what if there was a high-grade stenosis you didn't call, and then it becomes the legal issues of not looking at that. So it seems in general better just not to do it, which is what most people do. I don't know many groups that are doing coronary CTA 24/7. Just the coverage issues become more and more challenging these days. Yes, you're home, but you don't want to be home on your workstation all night long. So that becomes very, very important. When we talk about coronaries and cardiac, I'll also talk a little bit about TAVRs, which are the classic way now of replacing the aortic valve. We talk about TAVR planning, the measurements we make, whether it's at the aortic root or it's the vessels, looking at the vasculature, looking at the runoff vessels. We talk about doing some of this work for also looking at, make sure the patient doesn't have any incidental findings. Remember, TAVR patients are typically older. Most are over 60, a lot are over 70. Probably almost all of them are over 70. So you want to make sure you're not missing an incidental lung cancer, renal cancer, even colon cancer. So that becomes really big. So it's something that you need to really know how to do. There's calculating depending on what type of valve you're going to put in, how you measure things, and it's good to have at least one of your techs be able to do that, so you can work very nicely with the cardiac surgeons, the vascular specialists who are going to put the stents in. So with Cardiac Month, again, I'll just say that we are working on a lot of things. If you have some suggestions what we should do, please let me know and we'll try to do that. We also have recently published some articles. If you go to JACR, we published 3 articles from our speakers, really good articles. I think it's worthwhile to read them. They're still PDF, so maybe just hold off a couple days. Maybe they'll be better formatted. Though there's nothing wrong with reading a PDF. It just takes a little bit longer. It's multiple pages. I see Liliana says hi. Hi, Liliana. I see Hassan from Tehran says hi. So, and John Biacchino from Body CT across the street says hi. And yes, I know Lily put up that thing. It's my birthday, so I will thank everybody for their well wishes. And I wish everybody who has a birthday today and tomorrow and the day after and the day after that only the best as well. And with that, I think I'll stop there and get back to work. I hope everybody has a great day. See you soon.